Hello everyone, welcome back to my channel. I am Namuna Kharal, and in today's video I am going to share some of the strategies that would be helpful for the Nclex. And at the end of this video we'll be practicing the Nclex style question based on one of those topics that we are going to discuss today. So please watch the video till the end. So let's begin with additions and the Cushing stages, which is one of the important topics for the Nclex. First of all, we should know that addition and Cushing disease are the metabolic disorder associated with the cortisol hormone, which is produced by the adrenal cortex and that is located at the top of the kidney. So in this video, I'm going to mainly focus on the electrolyte imbalances associated with additions and Cushing's. And this is very important for the SATA question. I have already discussed in my previous video about SATA question. We know that in Addison's disease there is the decreased secretion of cortisol hormone, and in Cushing disease there is the increased secretion of cortisol hormone. But in exams sometimes we get confused like which one is the deficiency of hormone and which one is the excess of hormone. So in order to differentiate that, we can look at the word add in the Addison's disease, which means we have to add something. We have to add some hormone to this disease. So this way we can differentiate additions and the Cushing's. So if this is the deficiency of hormone, this should be the excess of hormone, right? Especially for the exam, how I studied was, look at this arrow. I have made this arrow just to make it simple. So when you look at this arrow, it is down, right? Down, 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 and this one is up, up, down, 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 up, up for additions, and up, 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 down, down for Cushing's. So the first down is sugar, which means hypoglycemia. So we have hypoglycemia in Addison's disease because cortisol hormone also helps to increase the metabolism of glucose. But due to deficiency of cortisol hormone in Addison's disease, we have hypoglycemia. We have decreased sugar in Addison's and we have increased sugar in Cushing's. And the other down is SALT. Which means hyponatremia. Sometime in the exam they might not directly give us options like hypoglycemia, hyponatremia. Beside this they might give us the lab values, and we have to identify which one is associated with addition and which one is associated with Cushing's. So for sodium we have the normal range is 135 to 145. So if it is below 135, this is for additions, and if it is above 145, the value is for Cushing's. The other down is BP. In additions we have hypotension, and in Cushing's we have hypertension. So we have to understand that 2P are increased in additions. Potassium and the pigmentation are increased in additions, and potassium and pigmentation are decreased in Cushing's disease. And for pigmentation, we have to know that bronzed skin pigmentation is for additions, and this is also very important for Nclex. And in Cushing's, pigmentation is decreased, but the skin becomes more fragile and that easily bruises, and there is a red purple stripe or the stress mark like lines on the abdomen and thighs on Cushing's disease. So these two skin pigmentations are very important for Nclex. And the normal range for potassium is 3.5 to 5, and if it is above 5, we know that is hyperkalemia, and hyperkalemia is for additions and hypokalemia is for Cushing's, which is below 3.5. So now let's move on to another topic, removing the PPE and wearing the PPE. This is also very important topic for the Nclex, and they will give this type of question in the form of drag and drop format, in which they will, on one side they will give us the boxes with options, and on other side the boxes will be empty, and we have to drag the options from this side to the boxes which are empty. So we have to keep in order. So this is the order for removing the PPE: gloves, goggles, gown and mask. So this is an alphabetical order. So if you notice this, L comes before O, and OG comes before OW. So G comes before M, we know that. So gloves, gog, gown and mask is for removing the PPE. So now for wearing the PPE, there is a little twist in gown and the mask. So the first one that goes with wearing PPE is, first one is gown and then mask, and in this form. Third one is gog and the gloves. So it is in alphabetical order, but there is a little twist in gown and the mask in wearing the PPE, and the goggles and the gloves are reverse form. Now another important topic for the Nclex would be from the ventilator alarm. We know that a ventilator deliver oxygen to our lungs. So especially for the Nclex, we have to remember two type of pressure alarm, a high pressure alarm and the low pressure alarm. So for this, I want you to remember the word HOLD, hold. So H for high pressure alarm and O for obstruction, which means high pressure alarm sounds due to the obstruction of the tubing in the ventilator, and the low pressure alarm sounds due to the disconnection of the tubing of the ventilator. So especially for the Nclex, they will ask us the causes of the high pressure alarm or the causes of the low pressure alarm. So this is also important for the SATA question. The obstruction may be due to increased secretion in the tube, or maybe due to patient coughing vigorously, or due to kink or biting of the tube. In this condition, the ventilator has to exert the extra pressure to deliver the oxygen to the lungs. So the high pressure alarm is due to obstruction, and for low pressure alarm we have to remember the word disconnection or the leakage from the disconnected sides, or maybe due to extubation, or when the patient stops breathing. Another important format for Nclex style question would be the hotspot question, where they give us the picture and we have to locate the certain area on the picture based on what the question is asking. So this is one of the example where we have the area of heart sound auscultation, and this is the aortic, pulmonic, tricuspid and the mitral valve. So we can remember this by apartment M 2245. So aortic, pulmonic, tricuspid and mitral, and this is the right second intercostal space, this is the left second intercostal space, and tricuspid is in fourth intercostal space, and mitral valve is in fifth intercostal space. Or they may also ask us the question like locate the area where we can find the apical pulse. So our answer would be on this area, which is the apex of the heart. So or the area where we can find the point of maximum impulse. So the thing is same, we have to locate this area. This is the apex of the heart and this is the base of the heart, which is the opposite of the lungs. For lungs, top part is the apex of the lung and bottom part is the base of the lungs. And we should remember that we have to check the apical pulse for 1 full minute before giving the drug digoxin, which is the cardiac glycoside. Now let's do one Nclex style practice question. We have a question: a client with a diagnosis of Addison's disease is being admitted to the intensive care unit. Which finding will the interpersonal healthcare team focus on? Select all that apply. So this is a SATA question, and the question is asking us about the findings that are related to Addison's disease. So they have given us 5 options, and we know that for Addison's disease we have down, 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 up, up. So the first down is sugar, second one down is sodium, the third down is BP, and 2P are elevated in Addison's disease. So we have been given 5 options. The first option is hypotension. So we have to identify from here, is hypotension associated with Addison's disease? Yes, because we have decreased BP in Addison's disease. So this is a correct answer. And the second one is hypernatremia. Is hypernatremia associated with Addison's disease? No, because hypernatremia is associated with Cushing's disease. We have decreased sodium in Addison's. So this is a wrong answer. So we treat each option individually. And third one is hyperkalemia. Yes, because 2P are increased in Addison's. So hyperkalemia is correct answer. The fourth one is leukocytosis. Leukocytosis is increased WBC, and this is not related to Addison's disease. So this is a wrong answer. And the fifth one is hypoglycemia. Yes, this is a correct answer because we have decreased sugar in Addison's disease. This is a correct answer. So our correct answer is 1, 3 and 5. 1, 3 and 5 is the correct answer. In this way we do our select all that apply question. We have to treat each option individually, and for this we should know our content first. In next video I'll come with some other important topics about Nclex. If you like this video, please do subscribe to my channel. Thank you for watching. Stay safe.